Okay, welcome students. This is a part of pediatric history and physical examination. Today we will see how to assess physical examination for pediatrics age groups. Before going to physical assessment, it's better to see or detail about what is physical assessment, what's the principle and techniques of physical examination. So to examine the whole body when starting with head and the end as feet, especially cephalocaudal. Cephalo means starting from head, caudal means to extremity. In case of a small child, you should make it a habit and raise child and examine the whole body. So observation is crucial for assessing pediatrics age groups. You can gathering a lot of information by observing. Third point is to examine the whole body when starting with head and end at the feet. Do unpleasant procedures last and quickly. Example, rectal examination as the last after doing some pleasant procedure, then after the end of unpleasant ones. Examine the child according to what you expect to find from the history. The last part is the most important method of examination is inspection or observation of the child. So the best thing to assessing a child, you use your eye and fingers than stethoscopes, because by observation you can get a lot of information about child's problems. So what is the difference in the performing pediatric physical examination compared to an adult? General approach, much of information in pediatrics can be gathered by observations and position of a child or on the parent labs versus examination tables. In adult examination, you can place adult on the examination tables, but in the children's or pediatrics age group, mainly parents lab. And pediatrics, stay at the child level as much as possible. Don't tower yourself, because maybe when you are towering yourself, or maybe you are sitting above the child, or that you are maybe bending your level higher than the child, which may disastering or distressing the child. So always when you are examining a child, your sitting levels, it's better to be at the same level to the child. So on examination, the better thing, examine least to most distressing in children. In adults, it's optional. So this is the main thing for difference of physical examination in pediatrics than adult. Maybe rapport with child, including child explanation to the child levels. Maybe distraction is valuable tools. And examine a painful area. Last, get general impression of overall attitudes. Be honest. And sometimes it's going to hurt. Tell them that is a claim patience. Don't lie or you lose credibility. So it's a better thing to be good communication or sharing of your impression towards child. It's better to use simple, understandable and true words, and understand developmental stage impacts on child response. Don't overfeed unnecessary information for a child. Before talking with a child, it's better to use appropriate terms or words which is understandable by children by his or her age levels. For example, stranger anxiety is a normal stage of development which tends to make examining a previously cooperative child more difficult. So, which is the most important part of physical examination for a child. So the second things, it's the most important part of pediatrics physical examination. One is a vital signs. Maybe normally different from adults and varied according to age. Those important parameter or vital sign methods like temperature, heart rates, respiration rate, blood pressures, and arithmetics. So we will see in detail about those parameters. Example, temperatures. Temperature, you know that, which is assessing the heat of the body. The normal range of body temperature, which is 36.5 up to 37.4 degrees Celsius. Especially if the child is greater than 6 years, the best area for taking a vital sign or temperature, oral or tympanic temperatures. So, if the child is less than 6 years or in disoriented, unconscious or in severe respiratory distress, the best site for taking a vital signs or temperatures like tympanic, axillary, or rectal method. NB. Don't take rectal temperature, especially child with immune or hematological disorders, or rectal surgery, or diarrhea. Rather, don't take tympanic temperatures, especially a child with has ear surgery or infections. For those, use axillary measurement only if other methods are not possible. So axillary method is the least and which is less accurate as compared to other methods of temperature measurements. The other vital sign is pulse rates. Auscultates or palpates apical pulse. You know, apical parts of the fifth intercostal space, or palpate femoral pulse when the child is the age of child less than 2 years. Use antecubital or radial pulse, especially child age greater than 2 years, which measures from full minute in both cases. Full minute is important for assessing a child pulse rates, especially in condition which is a condition is normal. If a child with a severe distress, this option is not recommended because maybe which may time taking procedures that may leading the child to more distressful. The third vital sign is respirations. In normal condition, infants normally have periodic breathings. Take respiration before taking other vital sign. So, we will be unable to obtain an accurate respiration rate if the child is crying and counting for 1 full minute. So, site on which respiratory distress can be seen, like suprasternal, especially maybe the area between abdominal and diaphragmatic spaces, which may indicate that some depressions, which may indicate that child using other extra muscle for breathing. Supraclavicles, which is the end of lung, especially on the clavicular area, which is indicates that air hangers, subcostal, substernal, and intercostal space, which indicates or mainly site for respiratory distress. The sign for respiratory distress: xiphoid restriction, especially grunting or chest rings, nares dilation or nasal florings, grunting or nodding of head, which is a sign of respiratory distress. Based on immunocytes, the classification of breathing rates, especially a normal breathing rate for newborns from 30 up to 60 breaths per minute. According to immunocyte age classification, for assessing a normal breathing rate, especially for age less than 2 months, normal breathing rates, which is 13 up to 60 breaths per minute. From 2 months up to 12 months, normal breathing rate is less than 50 breaths per minute, and 12 months up to 5 years, less than or equal to 40 breaths per minute. The abnormal rate of breathing based on immunocyte classification for a newborn age less than 2 months or infant age less than 2 months, which is greater than or 60 or more, which is indicates that fast breathing. 2 months up to 12 months, greater than or equal to 50 breaths per minute, which is indicates that fast breathing. 12 months up to 5 years, breathing rate greater than 40, which indicates that fast breathing. Blood pressures, and currently we are the only way to assessing the blood pressure for newborns, especially by using capillary refillings. But for taking a vital blood pressures, appropriate size cuff or 2/5 width of upper arm, which is a good way for measuring blood pressure for child, especially for in resource limited area. The best way for assessing blood pressure by using capillary refillings. If capillary refilling which takes more than 3 seconds, which may be indicates a severe anemia. So that the other vital sign is anthropometric measurements. Anthropometric measurements, which includes weight, head, length, hair circumference, chest circumference, mid upper arm circumference, body ratio, or the skin measurements, so skin folds. And according to anthropometric measurements, weights, the first things are weight. The normal range of weights of newborns from 2,500 up to 4,000 grams. So at normal rate or range of birth weights at birth, maybe from 2,500 up to 4,000 is normal, which may doubling at the age of 6 months and triple at the age of 1 year, and the 4th time of birth weight at first years. Height or length of newborns, which is less sensitive measurement than weights, so that a normal newborn weight is from 46 up to 53 centimeter, and the average near to 51 centimeters. Hair circumference, which is a measurement used for infant age or children age up to 3 years, which is used to assess the size of head, which indirectly reflects that intracranial pressure or brain growth. So the normal range of birth hair circumference from 33 up to 35.5 centimeters. And the other parameter, anthropometric parameter, is middle upper arm circumference, age of child 1 to 5 years, normal measurement is 30.5 centimeter. Chest circumference, it is always less by 3 centimeter from hair circumference the first year. So in the first 2 years, measure the chest at the child nipple line using a paper tap, which is non-stretchable types of measurement. The normal chest circumference is 13 up to 33 centimeters. A skin fold measurement, which is to assess subcutaneous fat storage, and BMI to measure the mass of or the composition of fat and muscle childrens. So in physical examination, general appearance, better two steps for assessing physical examination of newborns. Statement of sticking and are important features. During observation, you can gather some information about child, neonatal status, level of conscious, distress, cyanosis. It's better information for assessing child conditions, either sick or all well looking. On the head, it's better to check size and shape of head, especially like acrocephaly or maybe cone-shaped head at the tops, or more depressed types of head shapes, and brachycephaly or short broad head, or plagocephaly, which is oblique shaped or more oblique diameter, maybe larger or wider than the lateral diameter, so that plagocephaly, which may be sometimes due to lack of or deficiency of vitamin D or calcium and so on. And the better thing on the head, it's better to see a fontanelle, either which is depressed or bulges. Bulging fontanelle in newborn, which indicates that increment of intracranial pressures inside, or maybe the suggestive sign of bleeding inside the craniums, or depressed fontanelles, especially when child age greater than 6 months, male, which indicates that depression, which indicates that dehydration or diarrhea. So those are things to be observed on head assessment, like cranotabs, maybe softening of cranial bones, and sutures, especially suture, which is a membrane used to aligning or attaching of bone structures. Hair distribution is important in assessing of on the head. On face, and it's better to observe is there symmetry, paralysis, bridging of nose sometimes, which is genetically. In other condition, it's bridge nose, which is sign of some pathological factors, especially if a child is acquiring of syphilis infections during pregnancy from his mothers, maybe bridge nose may happen. So it's better to see those deformity. Maybe size and shapes of maxilla and mandibles, and tenderness over the sinus, which may indication of inflammations. On the eye, strophism, especially which is abnormal or slant of papillary fissures, abnormal eye movements, or maybe conjunctivitis, sclera, bulging of nasolacrimal ductus, photophobia or squinting, exophthalmos, cataract, corneal opacity, exophthalmos, which is abnormal bulging or enlargement of eyeball, which is indicating or assessing during pediatrics age groups. ears shape and size, position of ear, maybe abnormal shape or structures, or positioning of ear, or observing from front and running line from inner canto to occiput, which may indicate that there is missing of kidney, maybe probability. Tympanic membrane or drum is ruptured or not. Hearing assessment, which is very important, or checking the mastoid bone at the back of it. Nose, nasal septums, mucosa, sinus tenderness or discharge. It's a good thing to assessing newborn breathing patency. Mouth and throat or lip, buccal mucosa, tongue, teeth and gum, palate, tonsil, posterior pharyngeal walls, color, lymph node or hyperplasia or bulging, gag reflex. It's important to assessing on mouth and throats because gag reflex, which is indicating that readiness for feedings. Gag reflex especially absent the child when age less than or premature or lovers with especially premature neonate may affected by absence of gag reflex. If there is absence of gag reflex when you are feeding, a child may be risks on aspiration. Next, maybe assessing thyroid glands, tracheal position, mass, presence or absence of nuchal rigidity for maybe neonatal sepsis. If a child may acquiring neonatal sepsis, maybe neonatal jaundice, neonatal infection or meningitis may causing like rigidity of nuchal rigidity, maybe sign of meningeal irritations. LGS, location, size, consistency or mobility is important to assess, observing whether there is defect or not. Lung and thorax inspections. Maybe you know that breathing in children, especially pattern breathings. Maybe abnormal breathing is normal in the infants, and breath breathing is normal in infants, especially between breathing. There may be pausing of breathing for 50 seconds, which is normal. If pausing of breathing greater than 15, which indicates that's apnea. And inspection on respiration rates, use of accessory measure or not, chest well configuration is important, assessment on lung and throats. And second, after inspection on the throats, especially auscultation. On auscultation, you differentiate whether the entrance of gas in the both lung equally or not. Is there abnormal sound or not? And lastly, it's not important. Rarely you are using maybe percussion or palpations. And cardiovascular systems and assessing pulse rates, especially quality in the upper and lower extremity, because it's better to assess and derangement or difference between the upper and the lower pulse rates. And in subabnormality, for example, a child with coarctation of aorta, the upper pulse extremity pulse rate somehow greater than the lower one, so that it's better to check pulse rates upper and lower extremity. On cardiovascular system inspection on bulge or activity or apical beats, palpation, point of maximum impulse, heavy auscultation, especially item, murmur or quality of heart sounds, important. On abdomen inspection, especially shape of abdomen, especially in infants, usually have protuberant abdomen and become more scaphoid as child matures, and better to see umbilicus for infection or hernia. Maybe muscular integrity is important to check sometimes. Maybe child with loss of abdominal muscle or lack of integrity of abdominal muscle, risk of maybe abdominal or intestinal obstructions. On abdomen, the second step is auscultation. Auscultation is better to identify whether first movement is normal or abnormal. Third one is palpation, any tenderness, and percussion as necessary. Rectal examination also maybe it's sometimes important to assess is there any anal fissure or polyps. GS, it's better to assess external genitalia, especially hernia or hydrocephalus. Hernia means protrusion of intestinal contents through weak abdominal walls. Hydrocele, leaking of clear fluid from intestinal content to scrotums. Almost all hernia is indirect. More than 50% of hernia is indirect. If can gently palpate if a child with hernia, don't poke finger into the inguinal canal because it may affecting the fascia. And the other thing is better to see cryptorchidism, especially and which can be appreciating during assessing testicles in the scrotums if lack of one or more testicles in the scrotum, which is known as cryptorchidism. Maybe sometimes the cause of cryptorchidism may be retractile testes or undescended of testicle from abdomen to scrotums. The other thing terminal stage in the adolescent, which is abnormal external genital developmental impairment in females, especially on males, and rectal and pelvic examination, which is not routine, which may be special things may need for assessing these types of problem. Musculoskeletal systems, checking of back, like sacral dimples, especially in at the back. It's better to see a lumbar area because maybe depression of lumbar area, which may due to spinal bifida. The other things, shapes of spinal cord, kyphosis, lordosis, or sclerosis, or abnormal curvature of spinal cord, which is better to assess in childhood age. Joint motion and also muscle is important parts of pediatric history physical examination. On extremity, on musculoskeletal system, it's better to observe extremities, any deformity or symmetry of extremity, or any edema, or clubbing of finger, especially clubbing of finger due to cardiopulmonary problems. So it's better to check in pediatric age groups. And Gantt, intoes or outoes, which is defects on the lower extremity, bow leg or knob leg, especially due to defects of lower leg strangles or limbs or hip dislocation, ortolani or Barlow signs, especially hip dislocation, can be assessed by a method of ortolani or Barlow signs. On spinal and back, it's better to check sclerosis, kyphosis, lordosis, dimples, spinal bifida, or stiffness of neck, and to assess meningeal irritations or deformity on spinal cords. And neurological examination, especially, which is the last part of physical examination of pediatric age groups, check sense of touch or pains, or check muscle tone by lifting the child by shoulders. Tender reflex are exaggerated in the young children. Test cranial nerves. So this is all about physical examination of pediatrics age groups. So as a revision, it's better to check before going to assessing physical examination. And what is the most important part of observing is the principle of physical examination. So after the end of this class, we will have written exams. So I will provide you in other sessions or after reading of this provided information and materials. So thank you for your attention. Stay home.